Hey, it's Angry Bill for Pre-Hospital Wisdom. This is part 2 of the Simplify series. Make sure to like, subscribe, and share. I hate to be one of those YouTube people. It's like it helps the channel a lot, but it really does. Make sure and share this if you like it, if you find it helpful, or if you know someone else who it might help. So the previous Simplify article established that pre-hospital providers are freaking awesome and that 2 main ways to make our job easier and provide better patient care are to do things right the first time and to take the easy road. Here we will continue that topic by explaining what I mean by doing things right the first time. Doing things right the first time is a huge trick, but it's so simple, so grounded in common sense that we don't think of it as a trick. But I think it's a skill that's really important. It relates to efficiency. Perform something once and only once. That's it. There are 3 finite resources that you are personally responsible for on an EMS call: brain cells, lung air, and 2 hands. Each topic or task that you have to think about wastes synapses that could have been synapsing about something else. Each question you have to ask for a second or a third or 4th time wastes air that could have been spent asking a different question. Each movement you have to repeat is energy wasted if it had been performed correctly the first time. Trust me, these wastes of synapses, movements, and air can feel individually insignificant, but can quickly add up. There are examples on almost every call, and they almost always drive me nuts. I'm embarrassed to say that my most personal, common failure to do it right the first time is when I don't pay attention to a patient's name and have to ask them for it again. It happens all the time. What it usually means is that I ask their name and begin to think about my next question without listening to their answer. When I see it in trainees, it makes me wonder what else they were told that they didn't actually absorb or comprehend. So it kills me each time that I do it. It's wasted air that I could have used to ask a question that I haven't already heard the answer to. Paying attention to my findings so I don't have to repeat them is critical. I hate it when I take a set of vital signs, get distracted, and forget the results. I despise having to waste time doing them again. Unfortunately, I struggled with this until I realized that I'm just like the world's worst waiter. No matter how sure I am that I got it, that I'll remember, I won't, and I need to write it down or I'll mess up the order. Every time I buckle any patient into the pram, I make sure to get a single chest belt as high as possible into every patient's armpits. With crossover chest belts, I make sure that they're where they should be. The leg belt should run just superior to the patient's knees. This is the position that a combative patient should be buckled into. But when I'm confronted with a combative patient, I don't want to take the time to think which path the seatbelt should take. I want to just get them strapped in. I habitually do it right each time the first time. So doing it on every patient establishes the pattern as a habit that I don't need to think about. More importantly, there are patients who surprise me by becoming combative suddenly and without warning. I don't want to have to redo the belt pass after they're wound up. Why do it twice? If I begin the transport with the belts just above the knees and high in the axilla, if the patient gets squirrely, all I have to do is tighten the belts. There's no need to be aggressive with belt tightness with a normal patient, but the location and path of the belts is an important habit. I don't have to use brain cells trying to decide if the patient needs more secure belting or the half-assed belting version. I've seen partners place 4 EKG electrodes, run the incomplete 12 lead, which is really a 6 lead strip with the diagnostic filters running, decide that they need the full 12 lead, place the other 6 electrodes, and then run the 12 lead again. Why wouldn't you just do the 12 lead right the first time? This will probably be a complete post on its own eventually, but, and I hate to break this to you, it's 2023. An EKG includes 12 leads, not 6. If it's important enough to need an EKG, it's important enough for all 12. One of my favorite partners from the past had the habit of listening to breath sounds after each blood pressure. He would lift the stethoscope off the patient's arm and place it onto their chest. If he took 3 blood pressures, he had 3 sets of breath sounds. The habit was established to the point that he never had to waste his attention span thinking about whether he wanted to take breath sounds or not. They were just taken. It also meant that he would hear something abnormal when it was unexpected. Everyone expects adventitious breath sounds when they're treating an asthmatic, but you really look cool when you find abnormal breath sounds in a patient with an ankle injury. This idea of doing a task right the first time reaches into everything that we do, and it's a huge time saver. How many times have you had to send someone back to the bus to get a piece of equipment that you should have brought into the call in the first place? Have you ever had to make a second phone call to medical control because your first call was so incomplete? I have. Have you ever had to return to an address to revisit the patient that you should have just transported the first time you saw them earlier in the shift? How many times did you have to open the same cabinet on the same call? That's another one that drives me insane. Doing something once is twice as fast as doing it twice. How's that for a wise quotation? Next up, taking the easier road. We'll talk about that next time in part 3. This is Angry Bill for Pre-Hospital Wisdom. Make sure, like, subscribe, share, get the word out. If you like this, other people will too. I appreciate your help. Until next time, stay safe.